Folks, do I feel targeted? Yeah, I do. Do I know who my accusers are? No, I don't get to know. Could I be disciplined by the Board of Medical Practice? Well, sure I can. There's 2 allegations they're investigating. If I have been spreading misinformation, then what about Governor Walz and the Department of Health? Right around March 1st, we had a Department of Health memo that talked about the purpose of, if you will, some of the measures that would be taken to dampen, delay, and decrease the peak, to allow the accumulation of PPE and make sure that our hospital capacities weren't being overwhelmed. In that memo, they say what effective measures are: cover your mouth, don't go out if you have cough or fever, avoid touching your face, your eyes, or mouth, cover your mouth if you cough, wash your hands frequently, minimize outings, socially distance. But what did they say were not effective measures? They said wearing masks is not effective, taking antibiotics is not effective. A month later, Governor Walz comes out, talks about 74,000 Minnesotans dying. Later on, he went back to 29,000, and right around then, I put a different video out saying just the facts. And I said, I'm not buying 74,000 Minnesotans dying, I'm not buying 29,000. And then this one came out a month later, right around May 1st. This is a model that they're using. And it says on here, Minnesotans' model projects nearly 1,000 deaths a day in mid-July. Well, folks, that's next week. So far, we have less than, right around 1,500, of which all but 300 of them have occurred in people in long-term care facilities, in large part because the Department of Health participated in decisions that put people with active COVID-19 disease in the nursing homes. And I'm spreading misinformation. Of course I am. I don't know what to tell you. I just know this is wrong. We're in a bad place. My wife asked me the other day, Scott, why did 911 pull us together as Americans so much? And why is COVID-19 breaking us apart? I think physicians are part to blame. Scientists are. We've become so darn political. Physicians and scientists in the past are supposed to be above the fray. They're not. I have this odd set of hats I'm wearing because I'm the vice chair of the Health and Human Services Committee in the Senate, and I'm involved in policy discussions and involved in bills that deal with providing relief for COVID-19. And on the other hand, I've been a physician in the trenches for 35 years. So I try to connect the dots. I don't try to present myself to be something I'm not. I'm not an epidemiologist, but yes, I've taken epidemiology classes. I'm not an infectious disease doctor, but I take care of infectious disease every day. I just want to leave you with a couple of questions you could maybe ask yourself. Do we think it's okay for physicians to certify in death certificates that someone died of COVID-19, even if there was never a COVID-19 positive test obtained, even if there was never a COVID-19 test done, even if a COVID-19 test hadn't even been considered? And maybe the worst even if the family had no clue that the death certificate they received for their loved one was going to say COVID-19. What do we want to be doing there? In Minnesota, I think the Department of Health is taking care of business. Those are important questions. I'm sure there are naysayers out there that think that I'm getting exactly what I deserve. Fine. If it can happen to me, I think, frankly, that it could happen to anybody. It feels ugly. It feels like some of the people that disagree with me don't want to have a conversation. I've asked many of you to have conversations, and you've not been interested. So, reckless advice regarding comparisons between COVID-19 and the flu. Spreading misinformation because I cried foul when I received a memorandum from the Department of Health on April 3rd, which directed me to a CDC link which says clearly that you could have a patient suffering from other medical problems, wheelchair bound, severe stroke within the preceding year or two, no COVID-19 test ever done or ordered, and when that patient dies of pneumonia, it's a COVID-19 death. I cried foul. And I'm grateful that the Department of Health, a week later, tried to clarify things, and a month later clarified it further. But I'll say it again. The official people who write the coding Bible in this country said, if the provider documents suspected, possible, probable, or inconclusive, do not assign COVID-19. Thanks for listening. We better all stay engaged. Thank you.